Picture this: an elderly woman, once active and full of life, now finds herself confined to a chair. She used to take morning walks, dance at family gatherings, and move effortlessly. But over time, something changed. It started with mild discomfort, just a little soreness in her feet. She ignored it, thinking it was just part of aging. Days turned into months, and the discomfort turned into pain. Then came swelling, infections, and eventually she could barely stand without wincing. Before she knew it, their independence was gone. Her feet, something she never thought twice about, had become the reason she was trapped in her own body. This isn't just a story. It's happening to millions of elderly people around the world. Foot problems might seem minor, but for seniors, they can be a silent killer. Studies show that nearly 1/3 of adults over 65 suffer from serious foot conditions, and the consequences go far beyond discomfort. Neglected foot health leads to chronic pain, mobility loss, falls, and even life-threatening complications like infections, blood clots, and amputations. In fact, falls caused by foot problems are one of the leading causes of injury-related deaths in seniors. And yet, no one talks about it. We visit doctors for heart checkups, eye exams, and bone density scans. But how often do we check the very foundation of our body? Why do we ignore our feet, the very thing that carries us through life? Today, we're breaking the silence. In this video, we'll expose the hidden dangers of elderly foot health, why it's more dangerous than you think, the warning signs you should never ignore, and most importantly, how you can protect yourself or your loved ones before it's too late. This isn't just about comfort, it's about survival. Stay with us, because what you're about to learn could save a life. As we age, our bodies go through countless changes, but one area that often gets overlooked is our feet, the very foundation that supports us every single day. While a small ache or a rough patch of skin may seem harmless, these minor foot issues can quickly spiral into serious, life-threatening complications if ignored. Let's start with the most common foot problems in seniors. Many elderly individuals suffer from corns, calluses, bunions, and chronic fungal infections like athlete's foot or toenail fungus. These conditions might seem minor, but they can cause persistent discomfort, making it harder to walk or even stand for long periods. Left untreated, they can lead to open sores, infections, and severe mobility issues. But the real danger lies in the more serious foot complications that go unnoticed until it's too late. One of the most alarming conditions is diabetic foot ulcers. These aren't just small wounds. They can become deep, infected sores that, if untreated, lead to gangrene and amputation. According to medical experts, diabetic foot ulcers account for nearly 85% of lower limb amputations in diabetic patients. That's a terrifying statistic. And it doesn't stop there. Poor foot health can also lead to severe circulation problems, nerve damage, and an increased risk of falls, which are one of the leading causes of injury-related deaths among seniors. A simple cut or blister can turn into a life-threatening infection before anyone realizes what's happening. This is why foot health isn't just about comfort, it's about survival. Ignoring these issues can strip seniors of their independence, mobility, and ultimately their quality of life. But the good news: most of these problems are preventable with the right care and attention. Up next, we'll uncover why foot health deteriorates with age and the warning signs that you should never ignore. Stay with us, because this could save a life. Aging affects every part of the body, and our feet are no exception. But why do so many seniors struggle with foot pain, swelling, and serious complications? The answer lies in a combination of natural physical changes and underlying chronic conditions that make foot health decline over time. Let's start with the physical changes that come with aging. As we get older, the structure of our feet begins to change. The fat pads on the soles become thinner, reducing the natural cushioning, that once absorbs shock with every step. The skin also loses elasticity and moisture, making it more prone to cracks, cuts, and infections. Circulation is another major factor. Over time, blood flow to the feet decreases, slowing down the body's ability to heal wounds or fight off infections. That's why a small cut on a young person's foot might heal in days, but for an elderly individual, it can take weeks or even months, sometimes leading to severe complications like ulcers and infections. Circulation is another major factor. Over time, blood flow to the feet decreases, slowing down the body's ability to heal wounds or fight off infections. That's why a small cut on a young person's foot might heal in days, but for an elderly individual, it can take weeks or even months, sometimes leading to severe complications like ulcers and infections. But aging alone isn't the only problem. Chronic conditions make things even worse. Diabetes, for example, causes nerve damage, also known as neuropathy, which means many seniors can't even feel pain when they get a blister, cut, or wound on their feet. By the time they notice something is wrong, the infection has already spread. In fact, diabetic foot complications are one of the leading causes of non-traumatic amputations worldwide. Then there's arthritis, which wears down the joints, making it painful to walk and move. Stiff, inflamed joints lead to changes in gait, increasing the risk of falls, one of the biggest health threats to seniors. And let's not forget osteoporosis, which weakens the bones and increases the likelihood of fractures in the feet and ankles. The reality is that foot health isn't just about keeping your feet comfortable, it's about protecting your entire well-being. When your feet suffer, your mobility declines, your risk of falls increases, and your overall health takes a serious hit. But here's the good news. Many of these issues can be managed and even prevented with the right care. Coming up next, we'll explore the real consequences of ignoring foot health and what you can do to protect yourself or your loved ones. Stay with us, because this information could change a life. Ignoring foot problems isn't just about dealing with a little discomfort. It can have serious, life-changing consequences. When foot pain, swelling, or deformities are left untreated, they don't just stay in the feet. They begin to affect the entire body, leading to mobility issues, dangerous falls, and even life-threatening health conditions. Impact on mobility. Your feet are your foundation, and when they hurt, everything else suffers. Foot pain, bunions, swelling, or arthritis-related stiffness can make even the simplest movements unbearable. What happens then? Activity levels drop. Seniors stop walking as much, avoid exercise, and even limit their daily activities just to avoid the pain. But this loss of movement doesn't just take away independence. It slowly leads to muscle weakness, poor circulation, and a decline in overall strength. The less a person moves, the harder it becomes to regain mobility. What starts as a small issue, maybe a painful toe or a stiff ankle, can quickly spiral into losing the ability to walk without assistance. The risk of falls. One of the biggest dangers of foot problems in the elderly is the increased risk of falls. Studies show that foot pain, poor balance, and foot deformities significantly increase the likelihood of falling, a leading cause of serious injuries and death among seniors. Think about it. If your feet hurt, you automatically change the way you walk. You might shift your weight differently, take shorter steps, or avoid putting pressure on a painful area. But these small changes throw off balance and stability, making falls far more likely. And for older adults, a single fall can be devastating. It can result in broken bones, hip fractures, head injuries, and even permanent disability. Many seniors never fully recover after a serious fall, leading to a loss of independence and a decline in quality of life. Overall health decline. But the consequences of foot problems don't stop there. When mobility is lost, the entire body begins to suffer. Muscle atrophy. When you stop moving, your muscles weaken. Over time, this leads to frailty and an increased risk of injury. Cardiovascular issues. Limited movement leads to poor circulation, high blood pressure, and a higher risk of heart disease. Weight gain and diabetes complications. When seniors stop being active, their weight increases, insulin resistance worsens, and diabetes-related complications become more severe. All of this from something as seemingly minor as foot pain. The silent epidemic. We can't ignore foot health isn't just about comfort, it's about survival. A simple, untreated blister can turn into a life-threatening infection. A minor balance issue can lead to a devastating fall. A little foot pain can be the beginning of a total loss of mobility. But here's the good news, this is preventable. Up next, we'll reveal the simple but powerful steps you can take to protect yourself or your loved ones from these hidden dangers. Because taking care of your feet means taking care of your future. Stay with us. This could save a life. The good news is that foot problems don't have to be an inevitable part of aging. With the right care, many of these issues can be prevented or managed effectively. Your feet carry you through life, and taking care of them now means protecting your mobility, independence, and overall health for years to come. 1. Regular inspections. Catch problems early. The first step to maintaining healthy feet is paying attention. Many serious foot conditions start small, a tiny cut, a bit of redness, or a mild swelling that might not seem like a big deal at first. But for seniors, even minor foot injuries can escalate quickly into infections, ulcers, or worse. That's why routine self-examinations are crucial. Check your feet daily for cuts, sores, swelling, or any unusual changes. Use a mirror or ask a loved one for help if you have trouble seeing the bottoms of your feet. If you notice anything unusual, pain, discoloration, numbness, or wounds that won't heal, don't ignore it. See a doctor immediately. 2. Proper footwear. The right shoes make all the difference. One of the biggest causes of foot problems in seniors is poorly fitted footwear. Shoes that are too tight, too loose, or lack proper support can lead to bunions, blisters, pressure sores, and falls. When choosing footwear, keep these key factors in mind. Go for comfort and support. Well-cushioned, non-slip shoes with good arch support are ideal. Avoid high heels, narrow-toed shoes, or worn-out footwear that strains your feet. Get your feet measured regularly. Our feet change shape over time, so don't assume your size stays the same forever. 3. Hygiene practices. A simple routine for healthy feet. Good foot hygiene isn't just about keeping your feet clean. It's about preventing infections and keeping the skin strong and resilient. Wash your feet daily with mild soap and warm water, making sure to clean between the toes. Dry them thoroughly, especially between the toes, to prevent fungal infections. Moisturize daily to prevent dry, cracked skin, but avoid applying lotion between the toes as excessive moisture can lead to fungal growth. Trim your toenails straight across to prevent painful ingrown nails. 4. Exercise and flexibility. Keep your feet strong and mobile. Just like the rest of your body, your feet need movement and exercise to stay strong and functional. Simple foot exercises can improve circulation, flexibility, and balance, reducing the risk of falls and stiffness. Try these easy exercises. Toe yoga. Lift and spread your toes, then press them into the ground to improve flexibility. Heel to toe walk. Walk in a straight line, placing one foot directly in front of the other to improve balance. Ankle circles. Rotate your ankles to enhance mobility and reduce stiffness. Toe curls. Pick up a small towel with your toes to strengthen foot muscles. Just a few minutes a day can make a huge difference in maintaining foot strength and mobility. 5. Professional care. Don't wait until it's too late. Regular checkups with a podiatrist, are just as important as doctor visits for heart health or vision. Many foot issues can be managed before they become serious, but only if they're caught in time. Schedule a professional foot exam at least once a year. For diabetics or those with circulation issues, more frequent visits are recommended. Never ignore persistent foot pain, numbness, or slow healing wounds. These are red flags that need medical attention. Final thought: your feet, your future. Your feet are more than just a part of your body. They are your freedom, your mobility, and your connection to the world. Taking care of them isn't just about avoiding discomfort. It's about protecting your independence, your ability to stay active, and ultimately, your quality of life. The time to take action is now. Start with small daily habits, pay attention to changes, and seek professional care when needed, because healthy feet lead to a healthier, longer, and more fulfilling life. The stories no one talks about until it's too late. Imagine this: John, a 72-year-old retired teacher, always loved his morning walks. But over time, he started experiencing sharp pain in his heel. At first, he ignored it, just another part of getting older, he thought. Months passed, and the pain got worse. His daily walks became shorter. Soon, he stopped going outside altogether. Then came the real nightmare. One day, he lost his balance while getting out of bed and fell. A broken hip, surgery, months of rehab, and it all started because of an untreated foot problem. John isn't alone. Thousands of seniors suffer silently from foot pain, infections, and deformities that strip away their mobility, their independence, their joy. But what if someone had told him sooner? The wake-up call, Maria's story. Maria, 68, developed a small sore on her foot. She didn't think much of it until it refused to heal. Weeks turned into months. When she finally saw a doctor, she was diagnosed with a diabetic foot ulcer. The infection had spread. Doctors had no choice but to amputate part of her foot. "I wish I had taken it seriously sooner," she says. "I never thought a tiny sore could change my life forever." Maria's story is a harsh but necessary reminder. When it comes to foot health, early action is everything. What the experts say. Dr. Emily Carter, a podiatrist specializing in elderly foot care, warns. Many seniors assume foot pain is just part of aging, but that's not true. Most foot issues are preventable and treatable, but only if we address them early. The biggest mistake people make: waiting too long. By the time they seek help, the damage is often severe. Dr. Carter emphasizes 3 golden rules for foot health. Never ignore persistent foot pain. It's a sign something is wrong. Check your feet daily, especially if you have diabetes or circulation problems. Get professional foot exams regularly, even if everything seems fine. A call to action. Don't wait until it's too late. John and Maria's stories are not just stories, they are warnings. Foot problems can be life-altering, but they don't have to be. If you or a loved one are experiencing foot pain, swelling, or slow healing wounds, don't ignore them. Take action today, because healthy feet mean a healthy life. Your feet are more than just a part of your body. They are your foundation, your freedom, your lifeline to independence. Yet, for too many seniors, foot problems go unnoticed, untreated, and ultimately, life-altering. We've seen the dangers of neglect. John lost his mobility. Maria lost part of her foot. Their stories are real, and they serve as a powerful reminder. Foot health is not optional. It's essential. But here's the good news: most foot problems are preventable. A simple daily foot check can catch early warning signs. Wearing proper footwear can prevent pain and injuries. A visit to a podiatrist can mean the difference between early treatment and irreversible damage. The time to act is now, not when the pain becomes unbearable, not when walking feels impossible, not when it's too late. Take control of your health. Take care of your feet, because when you do, you're not just protecting your steps, you're protecting your future.